We are continuing our discussion on the coronavirus or COVID-19 pandemic. With new case numbers improving throughout the country and here in Florida, many residents are questioning what we should do next. The CDC has issued new face mask recommendations for the fully vaccinated. So, what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our state medical professionals, and joining us is Alvina, epidemiologist with the Florida Department of Health in Orange County. Alvina, thank you for being with us today.
Thank you for having me.
So tell us about the new CDC Mask Recommendations and some of the other new policies that are coming on board.
Well, so CDC recently, the guidance has, we've been very cautious about getting enough data and enough information to be able to provide guidance to the general public. And this is something that happens with every new disease or every new epidemic that comes around is, we want to make sure we get some good research. And so we finally have caught up with the good research, and basically the message is the vaccine is really good and it protects us and protects others and it helps reduce transmission. And so the guidance is if you are vaccinated, then we recommend that you can still, you can go out and do normal things again, especially in places like outdoors where the ventilation is really good. If you still have concerns about persons who might be vulnerable in your household, please be cautious and wear the mask around them. And if there are unvaccinated persons, those persons are recommended to still wear masks and practice the pandemic precautions as they are not yet protected. And so we're really encouraging people to get the vaccine because we've seen a drastic decrease in deaths, severe hospitalizations, and even transmission. And so the vaccine has really been the greatest effect there.
And we've had some changes in who's eligible to get the vaccine. Who is eligible now?
So very recently, or most recently, I think it was Easter Sunday is my recollection, or around Easter weekend, Pfizer was approved by the FDA with an emergency use authorization to go ahead and administer the vaccine to those who are 12 to 17 years. So previously, the Pfizer was for 16 and up, and they got the EUA for 12 to 15. And so now those persons who are 12 and up can get the Pfizer vaccine. Recently, Moderna has released some very good data, and they will be applying for their EUA. So soon, Moderna for 12 to 17 will be available.
And I understand that there are also some trials that are happening for even younger children. Is that still looking promising for younger children?
I think it's very early to say, but I mean, based on the previous trials for what we've seen from the 12 and up, we're hopeful. We're very hopeful. And we think this is one part that would be very important for us coming up in trying to end the pandemic, actually, ending it and going back to full normal life, is getting children vaccinated, because while people might think that they have either they don't get sick or they have asymptomatic infections or very mild infections, those are the ones who contribute to the transmission. They're kind of silent transmitters because you're not really aware of whether or not they're infected. And so they can definitely contribute to the spread of the COVID-19 virus.
And so for the rest of us who have already been vaccinated, will we need a booster shot at some point in the future?
So we're looking into that. It's unknown right now. We could predict that probably or possibly we will. As the virus mutates, as viruses do, we know that every new infection gives the virus an opportunity to gain mutations, some of which mean something, some of which might be very significant. We will be conducting surveillance, so not just case surveillance, but virologic surveillance to see what kind of genetic changes have happened and whether or not those who have been previously infected can retain immunity for any new variants that appear, and those who have been vaccinated, whether or not their immunity protects them from any new variants that appear. And so on the horizon, there might be this possibility for boosters.
And also, I've heard that we need to get somewhere between 75 and 90% of all American adults vaccinated to achieve herd immunity, and we are sort of far from that number. Is that something that you see as being ever possible?
So it's the community immunity to help prevent the transmission or help reduce transmission. It's not a specific magic number, so nothing magical happens once you cross a certain threshold. And I think we don't exactly know quite yet what level of community immunity we might need in order to halt transmission. So that might not be possible for us to ever, get to zero. So what we're trying to do is reduce transmission to a level that is livable, and also reduce enough transmission so that we don't have those large spikes of severe hospitalizations and deaths. So the primary goal would be to reduce severe hospitalizations and deaths. And so every vaccinated person helps us reach that goal, or helps us reduce the susceptible pool to reduce infections.
And on Facebook, for instance, you're starting to see some fringe outlets promote the fact that there are people who have been vaccinated but still got COVID-19. Is that something we should be worried about, or is that just fringe theory?
Well, so those are called breakthrough infections, and we know those occur. Those because not every vaccine is perfect, and not every vaccine is 100%. And also, people's immunities, they build immunity differently. So breakthroughs were expected to happen. It is the thing about the vaccines, though, is that they are extremely effective at preventing severe hospitalization and death. So even if you have an infection after getting vaccinated, there have been either very little or almost none of persons who have developed symptoms so severe they need to be hospitalized, and there have been no deaths for those breakthrough infections. And so this is the primary benefit of getting vaccinated.
And there is some shift in locations where you can get vaccinated. The Orange County Convention Center has shut down its vaccination spot. So there are other places. So where can people get a vaccination now?
So coming up very soon, the county-run vaccination sites at the 4 Magic Gyms will be closing. But you can still, there are over 100 locations at local pharmacies, your CVS, your Walgreens, your Walmarts, and your Publixes, where they do offer COVID-19 vaccines. Also, we are hosting mobile sites at workplaces and at communities where there's been low vaccination rates, and also where it might be harder for persons to go out and get vaccines or have somewhat difficult access to medical care. And so we're focusing on those kinds of locations. And certainly you can still get a vaccine at Barnett Park, which will be county run. And they also do testing there, which will be another important phase as we see the cases go down. Testing and identifying new cases, and then responding to those quickly is an exceptionally important part.
Well, Alvina, thank you so much for being with us, and as always, keeping us informed from the front lines of this pandemic. We appreciate you.
Thank you.
And we'll be right back with more. Stay with us. Let's get an update from our local medical professionals. And joining me is Dr. Christian Zuver, the Orange County EMS Medical Director. Dr. Zuver, thank you for joining us today.
Thanks for having me back. It's always my pleasure.
So, Dr. Zuver, where are we when it comes to vaccine rates here in Orange County? What does that look like? How are we doing?
So we see ebbs and flows with our daily vaccine numbers. We're climbing to those numbers that the mayor has set forth to kind of loosen things and feel better. We are winding down, believe it or not, some of our vaccination sites at the Magic Gyms and kind of transitioning towards a centralized site over at Barnett Park. I think everyone knows the convention center operations have closed down. So I think we're migrating to a steady state where we just have continued resources available to our citizens, where we've kind of dealt with the first surge, and now we're kind of moving into the day-to-day life as we progress forward.
And whether you're vaccinated or not vaccinated, what should we be doing to protect ourselves, to keep ourselves safe?
It's a good question. There's a lot of, I think, discussion about that currently. The CDC has recently changed masking guidelines and really kind of focused on a vaccinated versus a non-vaccinated approach. I think some of the other things that hold true and we've said throughout this whole pandemic are still there. So I know it's hard to totally split, but I'm gonna kind of go along the lines of CDC and the vaccinated, non-vaccinated. I think if we're in congregate settings, large congregate settings, everyone should be masking, and we should be doing our best to do social distancing. I think when we're in smaller settings with vaccinated individuals, you can start to loosen some of the requirements with your mask and kind of start to move back to where we came from at the start. Folks who aren't vaccinated should, of course, continue masking, social distancing, and all the personal hygiene points that we've been emphasizing the whole time.
So we've heard that you have donated convalescent plasma. Tell us about that experience and what that was like.
Sure, it was a pretty easy experience, I'll be honest with you. Convalescent plasma, earlier on in the pandemic, we had great hope that it was going to be a really great therapy for patients that were really sick from COVID. That we would give them the convalescent plasma, which would have antibodies to the virus. I think the literature has not been as supportive of that in these instances, but it's not any more difficult than giving blood, which is something that I advocate wholly to the members of our community. Blood and blood products are just a tremendous resource and life-saving resource. So I'm definitely in favor of donating whenever you can.
And what would you say to those who are still on the fence about getting a vaccine? At this point, I think that there are some opinions that are carved in stone, some, carved in wet jello that can still be swayed. But what would you say to someone who's still on the fence about it?
Well, I think you're absolutely right. I think we've seen those folks that are really pro-COVID vaccine. They've come forth, they've been vaccinated. And now we have folks who are either on the fence, and there's also a cohort of folks who it's just not right for, whether it's because of your understanding of your own medical needs and necessities or pre-existing conditions. For those folks that are still not sure and debating it, the first thing I think is, that relationship with your healthcare provider, it's a two-way relationship, and you should go to them with your concerns and have a really, truly open discussion about the risks and benefits of the vaccine for you. I think for most of the population, they'll come to find that the vaccine is safe and it's effective, and it's something we should really do for ourselves, for our family, and for our community.
There's so much focus on those who have medical issues and why it's important for them to get vaccinated. On the other end of the other side of the coin, it's those who are in perfect health, and that's one way to keep it that way.
Absolutely right. When talking to my family about the vaccine and my friends, I describe the whole pandemic as like a fire. A fire needs fuel and oxygen to breathe. For the virus, they need hosts that are susceptible to getting sick. And whether you're healthy at baseline or not, vaccination is one way to decrease the fuel for the pandemic.
Absolutely. Well, Dr. Zuver, we always appreciate you sharing your expertise and appreciate your view from the front lines of this pandemic. Thank you so much.
It's my pleasure. Thank you. Have a good day.
And we'll be right back with more. Stay with us. In Central Florida and across the country, many COVID-19 restrictions are finally being lifted. And not only is it difficult to stay up to date on these restrictions, but this evolving landscape can be challenging to our emotional health as well. Catherine Galda, the Director of Behavioral Health and Senior Wellness Services at Catholic Charities, is joining us to talk about managing our mental health during a time that we thought might be joyous. Catherine, thank you for being with us today.
Oh, Clarence, thank you for having me. I'm excited to be here.
So tell us a little bit about Catholic Charities and what it does.
Sure. Well, Catholic Charities is the service arm of the Diocese of Orlando, and we have many different programs that run throughout our 9 counties. So we're throughout Central Florida, although programs vary by location. We provide behavioral health services, so counseling services, senior wellness services, food service, programs that help individuals who are struggling with housing or maybe having some difficulty with paying some of their living expenses. We work with homelessness, and we work with immigration services as well. So we really seek to serve those on the lower end of the income spectrum whose needs would not otherwise get met. So we provide a lot of programming, but we also provide a lot of resource to help people move forward in their life and get to the positions in their life that they want to be at.
Exactly. That's great. And, you know, we are, I think, as a community, starting to have pandemic fatigue, and everybody's very eager to get back to some sense of normalcy and really trying to get out there. But how do we manage our expectations and stay grounded in reality when things are moving slower than we may have anticipated?
I think that, that's a terrific question, and one that we talk about and wrestle with quite a bit within our organization, but also individually with the clients that we're serving. I think we are all fatigued. We've all had quite enough. And one of the perspectives that certainly behavioral health takes on the pandemic is that it's like a slow wave traumatic event. So we've had a lot of changes in our lives and a lot of restrictions and really disruptions to our whole ways of being. And now that the pandemic is slowly beginning to wane, there's a kind of a spectrum response, right? There are folks on one end of the spectrum who are masks off and they're back in their lives as they were in pre-pandemic times. And then there are people that fall all along the spectrum, all the way to folks who are still not leaving their home. So it's hard to know what the correct response is. And often people are experiencing anxiety or uncertainty around how much do I put myself out there again? How much do I lend myself to getting back into the world?
And you know, Catherine, I think a lot of people were expecting sort of a flip of the switch, that things would just one day you'd wake up and we'd be back where we were in 2019. And that's just not happening. So is it normal to have those frustrations that we're like almost back to normal, but not really?
Absolutely. Experiencing frustration, experiencing anxiety, experiencing whatever it is that you're experiencing emotionally right now is considered to be with what I would call within normal limits. We want to get back out there. We want to resume our lives, but we've been through this traumatic event. And as a result of that, each one of us has experienced changes. We've experienced different emotional responses, and certainly a progressive kind of pressure related stress that stays with us even as we're emerging. So we have the want to get back to life as it was, and we have some hesitation about what that looks like. We're looking around in our community to look for, how are we supposed to be now? What is it supposed to look like? And that can be really anxiety provoking at times, because sometimes our own internal experience where we are doesn't match what other people or what people perceive other people to be doing. A great example of that is just going to your local grocery store. Some people are walking around unmasked and feeling very comfortable with that, and others are not. And so I find that we're looking around a little bit more, trying to see what the right thing is to do. And just like in the beginning of the pandemic, we're each individually struggling with what do we need to be safe? What do we need in order to be okay? And does that match or measure up with what people around us in our communities are doing? And we use that as kind of a measuring stick, if you will, to determine, how okay we are, how safe we are feeling. Does that make sense?
Absolutely. And especially when it comes to things like safety and how we judge what we're doing, if what we're doing is safe. Are you finding that there are generational differences in how people are viewing safety issues and sort of moving slowly through this process?
I have noticed, because at Catholic Charities in behavioral health, we work across the lifespan. Certainly, we see families with younger children, adolescents having kind of one way of being. They're still under the mandates provided by schools, so everyone is staying masked, and there's a kind of there's a structure around that. But as we age, and as we kind of get to the other end of the spectrum, to our older adults, many of them have kind of, as we age, we have what we call co-occurring medical conditions. So that provides another layer of questioning about how safe is it really to get back out there without a mask on? How safe is it really to go and join with our friends and do community activities and get back out there? So what I'm seeing on the behavioral health side, certainly working with older adults, is a hesitation to get back out there and resume normal activities. But that's also has to, there's another tension on the other side, in that being alone for long periods of time, that sense of isolation and disconnect that seniors can experience can actually produce greater mental health issues. So there's this kind of fine line balancing between, I'm really not comfortable going out yet, but by the same token, I'm very lonely and I really want to reconnect with my friends, not in a way that involves social media or being online anymore. I think older adults, and I don't want to speak for everyone, but I think older adults, they've had about enough of screen time and want to get back out there as best they can, but they have to balance that with their own anxiety and stress around potentially putting themselves in danger, because COVID is still out there. We're not done yet.
And along with those generational concerns, there are the specific situational concerns about things like going back to work, and specifically with us as an employee. Do you have any recommendations for people who might be uncomfortable with the protocols that they have that have been set up in their offices, or how some of their coworkers might be handling safety in the workplace and that makes them uncomfortable? What should they be doing?
Mm-hmm. Well, I think that's a great question, because I think it's something that we all struggle with, being employees in companies. Again, we see the same continuum that we see in life in general. We see that in a more microcosmic example when we're looking at our offices. My first suggestion is always go to your HR department, find out what the policy is, what are the protocols that are in place for your company, for your agency, so that you are aware of exactly what the rules are. Because as we emerge, our rules are changing, just like the information that we're getting. Everything is kind of in flux. My biggest suggestion would be to take a look at yourself. Right? We always have to start, whenever we have a struggle, with managing the things that we can control, because that helps us to feel grounded, that helps us to feel safe, that helps us know what the right thing is for us to do. So my first suggestion to folks is think about where you are. How comfortable are you? Do you mind having people come unmasked into your office? Do you not want that to happen? And then you need to make your needs known. One way to do that is to put, a simple sign on the outside of your office door, if you're lucky enough to have an office with a door that shuts, to put some kind of information out there, letting people know what it is that you need. And then if they do come in after the sign is posted or after you've made that known, it's really okay to be able to say in a kind way, hey, I'm really not comfortable. Would you mind going and getting your mask? Or would you mind doing a video conference? Some boundary that you set that helps you to feel more comfortable in your workplace. We all have a right to feel safe at work, just like we have a right to feel safe in the environment that we're living in. So it's really important to know what your boundary is. And then, if you need to practice that boundary before you say it out loud to someone, do that. That I find that often helps when we have to deal with a situation that we feel, in which we feel a little bit uncomfortable with the delivery. Practice it in the mirror, practice it on your spouse, practice it on the dog, but practice it so that then when the situation arises, you don't have that hesitation, and you can speak up for what you need in order to feel safe.
And there are signs throughout our community that a lot of people are just not handling this well. What resources are there for people who are struggling with this new normal?
Mhm. I think that's a terrific question. For Central Florida, we do have a tremendous number of resources at our disposal. My suggestion for all of us is learn. When we're faced with a difficult obstacle, when we're faced with a traumatic experience, one of the most grounding and healing things that we can do is understand that experience as best we can. So look up on, go to the World Wide Web, take a look at the resources that you feel like are reliable. They're going to be a little different for everyone. I tend to go back and look at information from, let's say, Johns Hopkins or the CDC or a place like that, that gives me up-to-date health-related information. As we move through this, there have been so many societal variables that are now coming into play. They've been in play all along, but now they're becoming more accentuated. Our financial concerns, social concerns, getting back the jobs that maybe we have lost, trying to become stable again. Catholic Charities has a tremendous number of resources, as we talked about in the beginning of this segment. You're certainly welcome. I think in the credits here, there'll be a contact information and connection directly to Catholic Charities. But you can always call 211. It's a great resource. You can look that up online. That's throughout Central Florida and gives categorical resources for different issues. So you can go to the issue that you have. It's an issue around housing or an issue around finding a new job or needing mental health care or psychiatric care. There are different categories right there where you can pick the drop down and you can find what you're looking for. And when in doubt, certainly give us a call. One of the beautiful things we have with Catholic Charities is we have a care coordination department that helps people find the resources that they need, even if it's not with us. So we're happy to do whatever we can to lend a hand and help people get connected to the resources that they need. There are books and other community resources in the information that we have to share with you today. So that'll be, I think, on the Orange TV website after the segment airs. And there's plenty of places to go and find additional info. I think the last thing that I would highlight, though, is when it comes to seeking resources is if you're struggling, if you're feeling uncomfortable, understand that that's normal. We've all been through a lot in this last year. And it has impacted each of us, period. Right? We're all impacted. So it's not that you're impacted and I'm not. We're all there in that same boat. We have different levels of impact, different types of impact, but understand that we're all in that same boat together. And that if you're feeling uncomfortable or you're feeling sad or blue or depressed or anxious or overwhelmed, you're not alone. And there's a lot of help out there for you. Please, I would strongly suggest seek it out. Go find it and take that chance, take that risk of feeling better.
Well, Catherine, thank you so much for being with us today and letting us know that change, even good change, like lifting the restrictions, can be difficult to process. We appreciate your time today.
Oh, Clarence, thank you for having me. It was a pleasure.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve our community. And we are also here to help you keep making those healthy connections. Stay safe.